Thank you for being here today. My name is Elena Kidd, and I'm a program director with the University of Alabama at Birmingham School of Public Health's Office of Public Health Practice. I'm excited to welcome you to today's webinar, Reporting Infectious Disease and Outbreaks to the Alabama Department of Public Health, featuring Tony Ritchie and Tina Norwood from the Alabama Department of Public Health. This webinar is made possible by the Alabama Regional Center for Infection Prevention and Control and Training and Technical Assistance Center, or ARC-IPC. The ARC-IPC was established to meet the consultation and support service needs surrounding infection prevention and control throughout the state of Alabama. The center is a collaborative effort of the Alabama Department of Public Health's Infectious Disease and Outbreaks Division and the University of Alabama at Birmingham. The ARC-IPC provides training and technical assistance to infection prevention and control and public health professionals in areas needed to detect, respond to, control, and prevent infectious disease outbreaks. You can learn more about the center, view and listen to past webinars and podcasts, sign up for our newsletter, request training and technical assistance, and view infection prevention and control resources at uab.edu/ARC-IPC. And you can also email arcipc@uab.edu. We would like to thank our co-sponsors for today's webinar, the Deep South Center for Occupational Health and Safety and the Alabama Statewide Area Health Education Centers. You can learn more about their programs and centers as a whole at the websites listed on this screen. This webinar has been approved with continuing education credits by the Deep South Center for Occupational Health and Safety for nurses. In order to receive credit for this training, you must register for the training, watch the entire program, complete the evaluation following the program, and upon completion of the evaluation, you'll be redirected to the Alabama Nursing CEU request form, which you will also need to complete. For nurses in the state of Alabama watching this program live, CEUs will be awarded directly by the Deep South Center for Occupational Health and Safety. You do not have to submit to the Alabama Board of Nursing. For those seeking a certificate of participation, please complete the Alabama Nursing CEU request form, and there will be a place for you to select that you would like to request a certificate of participation. CE units for this program will expire on April 23rd, 2025. If you have any issues or any questions about the CEUs provided, please email arcipc@uab.edu, and we'll place this email in the chat box as well. And finally, it's my pleasure to introduce our speakers. Ms. Tony Ritchie is a registered nurse and nurse supervisor within ADPH's Infectious Disease and Outbreaks Division's Northern District. Tony has worked over 30 years in a variety of settings, including physical rehab, adult medical ICU, outpatient surgery, endoscopy, as well as PRN positions for long-term care and nursing and school nursing. She began her career with public health in 2015 with ADPH as a district investigator for infectious diseases and outbreaks for the Northeastern District. Tina Norwood is a nurse supervisor within ADPH's Infectious Disease and Outbreaks Division Southwestern District. She is a registered nurse and has worked for ADPH for 29 years. She has worked with the Bureau of Communicable Diseases and Infectious Disease and Outbreaks Division for the past 12 years. So we'd like to welcome Tony and Tina, and I will now pass things over to you.
This presentation will provide an overview excuse me, of the reportable diseases and conditions required to be reported to the Infectious Diseases and Outbreaks Division within the Bureau of Communicable Diseases at the Alabama Department of Public Health. Our objectives today are to review the Infectious Diseases and Outbreaks Division Notifiable Disease Rules, discuss who should report, how to report, and when to report outbreaks and reportable diseases and conditions. We're also going to review frequently asked questions from required reporters. Before we get into the reporting rules, I wanted to take a moment to highlight the mission of Infectious Diseases and Outbreaks Division, which I'll abbreviate as ID&O throughout the presentation. Our mission is to protect the residents of Alabama and prevent illness by investigating and monitoring infectious, zoonotic, and environmental diseases, conditions, and exposures. Some examples include, for infectious diseases, salmonellosis and shigellosis. For zoonotic diseases such as rabies, West Nile virus, and Lyme disease. Environmental exposures such as mercury exposure, adult lead exposure, and legionellosis clusters. My role within ID&O as a district investigator is to investigate notifiable diseases and conditions and determine if they are a case using standardized definitions developed by the Council of State and Territorial Epidemiologists. Case counts are summarized at the State Health Department and sent to the CDC to compile annual summaries of the finalized data. It is also my responsibility to respond to outbreak reports of any kind. We work with reporters to obtain detailed case and exposure information and provide control measures to mitigate the further spread of the disease. So let's get into the Notifiable Diseases and Conditions reporting rules. The purpose of the Notifiable Diseases rule is to confirm disease, assist with patient education, and prevent further illness. It is required by law. The Code of Alabama states, the State Board of Health shall designate the diseases and health conditions which are notifiable. The diseases and health conditions so designated by the Board of Health are declared to be diseases and health conditions of epidemic potential, a threat to the health and welfare of the public, or otherwise of public health importance. The occurrence of cases of notifiable diseases and conditions shall be reported as provided by the rules adopted by the State Board of Health. Additionally, ADPH is exempt by HIPAA privacy rules, specifically for communicable diseases. You can reference our website for the ADPH General Counsel Opinion Letter. Regarding our notifiable disease rules, reporters of cases or suspected cases of notifiable diseases, outbreaks, or cases of public health importance will have immunity from civil or criminal liability. However, failure to report is a misdemeanor and upon conviction can impose a fine of $100 to $500. This slide shows the flyer that we share with notifiable disease reporters as a quick reference guide. You can access the full flyer on the Alabama Regional Center for Infection and Prevention Control resource webpage after today's presentation. It is recommended to print this guide in color so that the 3 time frames are easily detectable. For a brief review, you can see that each of the notifiable diseases are categorized into 3 reporting time frames. All time frames include weekends and holidays. The first time frame, seen in red, is immediate, extremely urgent diseases, conditions, which are to be reported to ADPH within 4 hours of presumptive diagnosis by telephone. Some examples include botulism, brucellosis, tularemia, and cases related to nuclear, biological, or chemical terroristic agents. Our second time frame, seen in blue, is the immediate urgent diseases and conditions that should be electronically reported to ADPH within 24 hours of presumptive diagnosis. Some examples include legionellosis, novel influenza A, which identifies a new strain of influenza A, and typhoid fever. The last reporting time frame is the standard notification diseases and conditions to be electronically reported to ADPH within 3 days of diagnosis. These include Campylobacteriosis, cyclosporasis, and Lyme disease. Per the new reporting rule, brucellosis is now a 4-hour reportable instead of a 24-hour. STEC has been moved from a 24-hour reportable condition to a 3-day reportable condition. Giardia, psittacosis, leptospirosis, hantavirus, and hepatitis E have all been removed. An primary ambic meningoencephalitis caused by the amoeba Naegleria fowleri has been added. Separate from the notifiable diseases and conditions list, ID&O also has reporting requirements through the Mike Denton Infection Reporting Act, which was passed in 2009 by the state of Alabama to better combat healthcare-associated infections, or HAIs. The Act requires the collection and reporting of certain HAI data by acute care and critical access hospitals. These facilities must report catheter-associated urinary tract infection, or CAUTIs, central line-associated bloodstream infections, also known as CLABSIs, and surgical site infections, or SSIs, from colon and abdominal hysterectomy surgeries to ID&O's healthcare-associated infections and antimicrobial resistance program via the National Healthcare Safety Network, also known as NHSN. HAI data must be reported no later than the last day of the subsequent month and includes the total count of device and procedure days, along with the total number of infections for the categories listed on this slide. Skilled nursing facilities have been mandated by CMS to report COVID-19 data into NHSN. This includes reporting resident and staff cases, in addition to point-of-care antigen testing. More information on COVID-19 NHSN reporting can be found on the link shown on this slide. In addition to the reportable diseases and HAI reporting described previously, outbreaks, clusters, and cases of public health importance must also be electronically reported to ADPH within 24 hours. We will take the next few minutes to review each of those definitions as well as provide some examples. Now, my colleague, Tina Norwood, will share further information about outbreaks.
So outbreaks of any kind include both notifiable diseases and diseases not required to be individually reported, such as norovirus, influenza, head lice, etc. An outbreak is defined as the occurrence of more cases of disease than expected in a given area or among a specific group of people over a particular period of time linked to a common source. It is imperative that outbreaks of any kind are reported timely so that appropriate control measures can be implemented. If an outbreak is suspected, facilities should not wait for laboratory results before reporting potential outbreaks. Facilities must report the outbreak independent of lab reporting. So in addition to the standard outbreak definition stated earlier, there are two diseases that have very specific outbreak definitions. These are Legionellosis and COVID-19, which we will review over the next few slides. For Legionellosis, I will start with the most common outbreaks we typically investigate. Those are healthcare and travel associated outbreaks. When investigating healthcare associated outbreaks, there are two case definitions that we use to determine whether a full outbreak investigation needs to be initiated. Those are defined as presumptive, and possible healthcare associated cases. A presumptive case is a case with 10 or more days of continuous stay at a healthcare facility during the 14 days prior to the infection. The 14 days before illness onset is known as the incubation period, which in other words, this is the time between exposure and symptom onset. This presumptive classification means that we presume that the infection was acquired at the facility. A possible healthcare associated case is a case that spent a portion of the 14 days before the illness onset in one or more healthcare facilities. This means that the case had other potential exposures during their incubation period, and therefore we cannot definitively say that the infection was acquired from their healthcare stay or visit. For travel-associated Legionellosis outbreaks, there must be at least 2 cases that stayed at the same accommodation with symptom onset within a 12-month period of each other. The other two main setting types for legionellosis outbreaks are those in confined facilities, such as correctional facilities, assisted living facilities, or group homes, and those in non-healthcare facilities, such as apartment complexes, schools, and casinos. The outbreak criteria for confined facilities is similar to that of a healthcare-associated outbreak, in that the identification of one case could prompt a full outbreak investigation if the case spent all nights of their incubation period in the confined setting. For non-healthcare facilities, there must be at least 2 cases of legionellosis who reported the same common exposure within a 12-month period. As you may have noticed, there is other outbreak criteria listed within each of the settings discussed. But again, I have highlighted the most common outbreak situations investigated by the health department. A quick reference guide for legionellosis outbreak investigations can be found on the resource webpage of the Alabama Regional Center for Infection Prevention and Control. Okay, so let's move into the COVID-19 outbreak definition for healthcare facilities. The outbreak definition on this slide, specific to hospitals and long-term care facilities, was adopted by ID&O on January the 1st, 2024. Before we review the definition above, let's review the definition for the term epilinkage. There are definitions for epilinkage among patients or residents and epilinkage among healthcare personnel. Epilinkage among patients or residents is defined as overlap on the same unit or ward or other patient care location, or having the potential to have been cared for by a common healthcare provider within a 7-day time period of each other. Epilinkage among healthcare personnel is defined as having the potential to have had prolonged exposure, which is defined as having been within 6 feet for 15 minutes or longer while working in the facility during the 7 days prior to the onset of symptoms. For example, the healthcare provider worked on the same unit during the same shift, and no more likely sources of exposure were identified outside the facility. Please keep in mind that determining epilinkages will require some judgment and may include weighing evidence whether or not patients, residents, or healthcare workers had a common source of exposure. For acute and critical access hospitals, COVID-19 outbreaks should be reported when there are greater than or equal to 2 cases of probable or confirmed COVID-19 among patients 4 or more days after admission for a non-COVID condition with epilinkage, or greater than or equal to 2 cases of suspect, probable, or confirmed COVID-19 among healthcare personnel, and greater than or 1 case of probable or confirmed COVID-19 among patients 4 or more days after admission for a non-COVID condition with epilinkage. For long-term care facilities and long-term acute hospitals, COVID-19 outbreaks should be reported when there are greater than or equal to 2 cases of probable or confirmed COVID-19 among residents with epilinkage, or greater than or equal to 2 cases of suspect, probable, or confirmed COVID-19 among healthcare personnel, and greater than or equal to 1 case of probable or confirmed COVID-19 among residents with epilinkage and no other more likely sources of exposure for at least 1 of the cases. There are also some single cases of certain rare and serious conditions that may elicit an outbreak-like response, such as gastrointestinal anthrax, botulism, targeted multi-drug resistant organisms such as Candida auris or carbapenemase producing organisms, and as mentioned previously, healthcare associated legionellosis. Clusters are the occurrence of more of disease than expected in a given area or among a specific group of people over a particular period of time without a common source identified. For a foodborne illness, this may be defined as 2 or more individuals with similar illnesses suspected to be associated with a common exposure, but investigators are unable to identify a shared food, animal, vector, venue, or experience among ill persons. For example, 12 cases of Shigella within a week in a single county, but investigators are unable to document a common exposure, or 2 or more cases of Salmonella in the same county with matching strains of bacteria. Now I'm going to give this back to Tony so she can discuss with you guys cases of public health importance.
Thank you, Tina. Cases of public health importance are considered to be individuals presenting with unusual symptoms or an uncommon disease as determined by a reporting healthcare provider, or a disease not normally seen in Alabama. An example would be a non-reportable disease that has caused alert or concern among local healthcare providers. Examples reported to the health department have included Candida auris, carbapenemase producing Enterobacteriaceae, Acinetobacter baumannii, Pseudomonas aeruginosa, necrotizing fasciitis, Acanthamoeba encephalitis, and pediatric hepatitis associated with adenovirus infection. Now that we have talked about what needs to be reported, let's switch gears and discuss who must report. Notifiable disease reporters include physicians, dentists, nurses, medical examiners, hospital and nursing home administrators, school principals, directors of child care centers, and laboratory directors. All reporters have equal responsibility for reporting diseases and/or lab results. This means that ADPH will receive multiple reports for the same person and condition. This is expected, and it ensures that all the information required for case investigations and case classifications has been received. As an example, lab reports do not always contain the patient's contact information, which is needed to conduct the case interview. Therefore, an additional report from the hospital infection preventionist, for example, would be needed and does include this information in their case report submission. There are several different electronic reporting forms. The one you complete will be dependent on the condition or disease you are reporting to the health department. The 4 reporting forms are the Communicable Disease Report Card, the COVID-19 Report Card, the COVID-19 Long-Term Care Investigation Form, and the Potential Outbreak Submission Form. First, we will review the report card for reportable diseases and conditions from the ADPH homepage. And I'm going to change what I'm showing really quick so I can let you see straight from the website. This is the homepage of alabamapublichealth.gov. When you get on the homepage, if you'll scroll all the way to the bottom to this purple section that says, How do I? You can find a multitude of things that you're looking for, but to report an illness, you can just hit the arrow here on the right and see where it says Report an Infectious Disease. Click on that, and it'll take you to the report card. So on the report card, I want to point out a few things. Let me not get ahead of myself here. Give me a second. Make sure I don't miss anything. So the first thing we're going to do is we're going to choose down just a disease. So when you choose your disease, it'll give you the elements that are needed. Okay. Then The next thing I want you to see that's really critical, in my opinion, is when you want to report an outbreak. Let's go back. We're going to report an infectious disease. Goes back to the report card. And in the drop-down box, you're going to choose outbreak. And this is where people miss something. When you read this paragraph, when you hover over click here, see how it turns red? That's going to take you to a new site also. And then on this page, we'll give you the potential outbreak submission form. All right, after this information is completed and submitted, it is then sent to the state health department, who will determine whether the submission warrants further investigation. One more thing I want to point out before we go forward. If you go back to the report card and you choose COVID-19, here it is, COVID-19 infections. It gives you specifics for each group that we were talking about. So we're only reporting, as of April 14th of this year, we're only reporting people who are living in congregate living facilities. And then it says, if you're a long-term care facility, there it is again, click here. If it's a jail or someone in a detention facility, there's another link to click to. And then lastly, other congregate settings, which can be dormitories, shelters, resident summer camps, mental health facilities. That is also a different link to go to. All right, so hopefully that wasn't too much, but we'll go back here and we're going to do outbreak again. Scroll down, outbreak, click here. It's going to leave the site, which is normal. You're going to submit your information. So as I said before, after that is submitted and completed, it goes to the health department and it's determined whether or not it's truly needs an investigation. Once that does, let me share this slideshow again. Let's see, current slide. Here we go. Potential outbreak. So if your submission warrants further investigation, your local district investigator will contact you to initiate the outbreak investigation. Outbreak response typically includes submission of specimens to the state lab, will complete a surveillance line list for those that are ill, and working with your regional infection preventionist to conduct a voluntary, non-regulatory infection control assessment, also known as the ICAR. Keep in mind that the surveillance line list should also include all ill individuals. So this is faculty, staff, residents, students, etc. All the people in your outbreak that are ill at the time of submission, as well as newly identified ill people during your outbreak. Let's move on to talk about COVID-19 reporting. And I think I hit on this a minute ago, but it's certainly fine to repeat it. As of April 14th, like I said, only cases who are living in congregate living facilities should be reported to ADPH. A congregate living facility is defined as a facility where persons reside and share common spaces with other residents, inmates, students, etc. Congregate living facilities can include, but are not limited to, residential care facilities, assisted living facilities, intermediate care facilities, skilled nursing facilities, jails, prisons, shelters, mental health facilities, dormitories, and residential summer camps. If the case is a resident of a long-term care facility, information about the case should be reported into the COVID-19 long-term care investigation form. And like I said, on that page through the report card, when you choose outbreaks, it's going to take you to that form based on what you're choosing. Skilled nursing facilities are satisfying this reporting requirement by reporting cases into the National Healthcare Safety Network, NHSN, and they do not have to use the COVID-19 long-term care investigation form to report. All skilled nursing facilities, COVID-19 data will be captured in NHSN, including hospitalizations and deaths. If the case is an incarcerated or detained individual at a correctional or detention facility, information about the case can be reported into the COVID-19 Correctional Facility Investigation Form. If the case is a resident of any other type of congregate setting, dormitory, shelter, resident summer camp, mental health facility, etc., information about the case can be reported into the COVID-19 report card. All forms can be accessed by selecting COVID-19 infection from the report card drop-down menu. To clarify, these forms would not be used to report staff cases. If the facility has resident and staff cases of COVID-19 infection, that should be reported as a potential outbreak per the COVID-19 outbreak definition that we reviewed earlier. Let's review the report card again to show what happens when COVID-19 is selected. Again, you have to hover over the word "Here" to access the link to the specialized COVID-19 report card. In addition to ID&O reporting requirements, healthcare facilities also need to report to the state regulatory agency known as Health Provider Standards, or HPS. More information about HPS reporting rules and forms can be found on the hyperlink shown on this slide. Healthcare facilities that fall under HPS include hospitals, long-term care facilities, and continuous care facilities, such as dialysis clinics and surgical treatment centers. Now we will transition to the frequently asked questions, and Tina will start us off with the first FAQ. Tina?
So the first frequently asked question is, if you report an outbreak and it continues for several weeks, do you have to report again? And so this is going to depend on the outbreak and the organism identified as the etiology. A good rule of thumb is to determine whether 2 incubation periods have passed since your 2 incubation periods have passed since your last known ill. If a new case is identified after this time, a new outbreak should be reported. Keep in mind that if new cases are identified after reporting an outbreak, the surveillance line list should be updated with those that are newly ill. For example, if you have identified multiple cases of salmonella in your facility and your last known ill was reported on May the 23rd, and you identify another case on June the 6th, you have surpassed 2 incubation periods between the cases and may have a new outbreak to report. The incubation period is typically 12 to 96 hours for salmonella, but it can be up to 7 days. So if there is no gap between cases and the outbreak continues for an extended period of time, this is not considered a new outbreak and should not be reported again.
Okay, the next one is, do facilities need to submit 2 reports, 1 per individual and a potential outbreak submission if outbreak definition has been met? Yes, individual case reporting is separate from outbreak reporting. All individual cases of reportable diseases and conditions should be reported via the report card. If the facility identifies an outbreak of any kind, they should report that separately to the health department by selecting outbreak from the drop-down menu for the report card for reportable diseases and conditions.
To meet the outbreak reporting definition, do 2 or more positives need to result the same day, or should you report an outbreak after 2 positives result over 2 or more days? To meet the outbreak criteria, cases do not have to test positive on the same day. Outbreaks can occur over an extended period of time. Therefore, facilities should report any suspected outbreak as soon as they have 2 or more individuals who are similarly ill and have a common exposure within a specific time period. Health department staff will work with facilities to determine whether potential outbreak submissions warrant further investigation.
Do we still need to complete the COVID-19 long-term care investigation form for each resident and employee case, as well as report an outbreak through the online incident reporting system? As of April 14th of this year, only resident cases need to be reported via the COVID-19 long-term care investigation form. Skilled nursing facilities will continue to report COVID-19 cases into NHSN as per the CMS mandate. Outbreaks should be reported to ID&O through the potential outbreak submission form. The use of the online incident reporting system is a separate reporting requirement through the Bureau of Health Provider Standards.
After reporting notifiable diseases or conditions and outbreaks, what additional follow-up is expected? Public health may request additional documents to include, but not limited to, medical records, laboratory reports, water management plans, and additional information as necessary.
How will information about outbreaks be shared? The facility will receive a final report at the conclusion of the outbreak. No personal identifiable information will be shared with the public. Facilities will not be named by ADPH. However, individual cases or the facility may release this information. If information has been released by a case, a contact to a case, a family member, social media, or a facility, etc., ADPH may be asked to respond to media requests.
Are facilities required to report over the weekend? Yes, facilities must report immediate, extremely urgent diseases, conditions within 4 hours of clinical suspicion. Immediate, urgent, reportable diseases conditions should be reported within 24 hours of presumptive diagnosis, and standard diseases or conditions should be reported within 3 days of diagnosis.
The list of reportable diseases still has 4 hours to report SARS-CoV-2. Please clarify. SARS-CoV, the pathogen responsible for the 2002 to 2003 SARS outbreak in China, remains to be a 4-hour reportable condition. SARS-CoV-2, the pathogen that caused COVID-19 infection, is a 24-hour reportable condition for congregate living facilities only.
What laboratory testing is required? This is dependent on the facility's laboratory capacity. There are no mandated testing methods required by ADPH. There are, however, certain pathogens for which laboratories are required to submit clinical materials for testing at the state public health laboratory. For information on laboratory specimen submission and reporting requirements, visit the Submission of Clinical Materials link as shown on this slide.
What are schools and child care facilities required to report? Outbreaks of any kind within 24 hours of presumptive diagnosis. All nurses are mandatory reporters. If the school or child care facility is notified of a specific disease or condition, they should refer to the Communicable Disease Chart for Alabama schools and child care facilities for exclusion criteria. A link to this chart is listed on the supplemental frequently asked questions page for today's presentation. Schools and child care facilities are required to report outbreaks of any kind within the 24 hours of recognition of a potential outbreak. I've got the exclusion chart right here behind me, and I'm just going to show it. Again, this is lovely and color coded for you. If you need one of these exclusion charts, we can try to get you one if you need something hands-on. However, it is two-sided, but you can link to it and it will show you the things that are red, you know, and gives you the exclusions for the students. This is very important and very helpful for school nurses. So I recommend every school have one in their health room.
Which outbreaks are schools required to report? Outbreak reporting is not facility specific. Schools should use the outbreak definition referenced previously to determine when an outbreak should be reported to the health department. Examples of outbreaks may include an illness among a sports team, extracurricular group, or classroom. For COVID-19 and other respiratory diseases, a good rule of thumb would be absenteeism of 20% or more of the school population. For other pathogens, the standard outbreak definition of 2 or more above would apply.
Will ADPH close a school in the event of an outbreak? The answer to that is no. ADPH will provide control measure recommendations. School closures are left to the discretion of the school system administrator.
Where can we find control measures for commonly reported outbreaks in schools? Please refer to the Fast Fact flyers on the ADPH webpage for control measure implementation. This link is provided on the Frequently Asked Questions supplemental form for today's presentation. Additionally, linked are the CDC web pages for individual diseases, conditions, reportable in Alabama.
Okay, again, I'm going to change this and pull up the ADPH web page. Whoops, I think I am.
And Almar.
So when you go to A to Z index, you can choose I, go to Infectious Diseases and Outbreaks. And if you scroll all the way to the bottom, here's all the Fast Fact flyers. They're very helpful and can be used for educations to the faculty and to the parents. Okay, let's go back. The next question, is there a different reporting mechanism for vaccine preventable diseases? Vaccine preventable diseases can be reported the same way through the report card for reportable diseases and conditions. Contact the Immunization Division with questions at these numbers listed or email them via this link below. Currently, measles cases are on the rise, and the Immunization Division is interested in reports of cases, whether through the provider's office or through a parent. Visit the measles web pages for more information.
Contact information. So these are links that you can use to contact the county health departments, ID&O district investigators, and infectious disease and outbreaks.
So that's the end of our presentation. Are there any questions that need to be covered, Melanie?
Hey, Tony. So a lot of questions about will the slides be shared? And so Elena has provided a PDF version of the slides. The presentation of the one-page flyer of the reportable diseases and conditions and the supplemental FAQ document will be posted to the ARC IPC resources webpage. And if they've got your contact information from your registration, you'll also get the all of the documents via email as well. So multiple ways to access what was shared today. There was a question that came in. What is needed if you have a patient who is suspected to have Chagas disease? I hope I'm saying that right. And the reporting process. I just responded to Felicia, just explaining that this is not a reportable disease or condition as part of our Alabama reporting rules. But if the provider feels that it meets the criteria to be reported as a case of public health importance, then they can do so using the report card just by selecting the case of public health importance option in the drop-down menu. So another question came in. So a single case of COVID in a nursing home needs to be reported on the REDCap report card. And if more cases occur and we meet COVID-specific outbreak criteria, then we fill out the potential outbreak form. So yes, assuming that this is not a skilled nursing facility, because skilled nursing facilities are using NHSN to report their cases, any other long-term care facility would report a single resident case via the COVID-19 long-term care investigation form. And then if you've got additional cases, such as 2 staff that are epi-linked, in addition to the resident that you just reported into NHSN, and it meets that COVID-19 specific outbreak criteria, then you would submit that as a potential outbreak submission, which is that separate form that you use to report outbreaks.
And I'm just going to jump in to say thank you so much for our presenters, Tony and Tina. Maybe if anybody is thinking of additional questions, you can put them in the chat box or the Q&A box. But I just want to say thank you for all of the work that you did in putting this together and putting together an FAQs list and responding to those. We really appreciate you going over this information because I know it's a lot, and I think it's really helpful to have you guys present it and be able to kind of take questions as people come. And I know it's just a small part of your job. So thank you guys so much. So if anyone has any other questions, you can put them in the chat box and the Q&A box. But as a reminder, the slides, the FAQ, that 1-page flyer that's also been in the chat, that will all be sent to all the registrants within a week with the recording to this webinar. So you guys should be getting a copy, and it will also be on our website.
And I'll just add, as you get some time to look over the supplemental FAQ document, a lot of the questions, we pulled the questions for the presentation from that FAQ document, but there's some additional ones that weren't really specific to reporting, but you may find useful. Some of them were related to COVID and some things outside of that. So if you have any questions from the supplemental FAQ, you can reach out to your local district investigator using that link on one of the earlier slides. You can email the epidemiology email that was on the contact us slide, or you can send it to the ARC IPC and they can forward it to us.
All right, so seeing and hearing of no other questions, then I'm going to let everyone go a little bit early. But just as a reminder, we do have 2 webinars that are part of our MDRO series that are going to be coming up this summer. Dates are still TBD, but look for that information soon. We'll send out a newsletter with those dates once they're scheduled. But thank you everyone for being here. And again, thank you to our presenters. You did a wonderful job and we're so appreciative of you being here. Thank you guys so much.
Bye.
Thank you, everyone.
Thank you, Elena.